and I'm here to show you 5 tips and tricks that will help make your clear aligner treatment more successful. Hi, this is Oakley, and I'm Dr. Brett Langston. I'm a prosthodontist and owner at Dental Implant and Aesthetic Specialist here in Brookhaven, Georgia.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
So, clear aligner treatment, is it right for you? I can absolutely say I have treated tons of patients, all the way from my 16-year-old daughter all the way up to a 95-year-old man. Every age in between, every situation in between. Clear aligners are a wonderful treatment option when we want to move the teeth, mostly in the aesthetic zone. So my 16-year-old daughter had a little bit of crowding and wasn't quite happy with her teeth. I know, daughter of a dentist should have perfect teeth no matter what, but we had to do a little bit of tweaking. And so we decided instead of conventional braces, we were going to go with clear aligner therapy. What that entailed, which came in, did our intraoral scans, x-rays, the rest of her mouth was healthy, everything was perfect, but we just had some crowding and some spacing that we weren't quite happy with. So we came in and started the process of the clear aligner treatment. Her case was about 20 weeks, so we had about 10 trays that we had to go through, and we learned a lot through her experience, and so I wanted to share that with you. Now, the majority of my team members, we've also done clear aligner treatment. We've done a lot on patients, like I said, from her age all the way up to 95. That's not a limit. I'm sure at some point I'll be treating a 100-year-old with some clear aligner therapy. You never know when that day comes. I'll be very excited. But the majority of my patients are adult patients because we get to the point in our 40s, 50s, 60s, and on that we start getting that crowding and teeth moving. And a lot of people are like, hey, you know what, not only does it kind of aesthetically bother me, I start to see in pictures they don't look quite the same, they're reflecting light different, it's not the same me. So a lot of times with clear aligner therapy, we can get everything aligned back up to how it was before the teeth started shifting. So I basically kind of narrowed it down to 5 tips to help you out with making your clear aligner treatment successful. Clear aligners are not designed for you to chew in. So when you're wearing them, you're going to have them in for about 23 hours a day. We really only want you to take them out to eat, to brush your teeth, and just do oral hygiene. So when the time comes that it's time to eat and you take your trays out, do not put them in a napkin and crumble them up, because I promise you, you put that napkin down on the table, somebody's going to take it and throw it away trying to help you out clean the table off. That is actually the number 1 reason that we have people calling us in like, oh my goodness, I've lost my Invisalign trays. Oh my goodness, I've lost my clear aligner trays. What do we do? Don't panic. The nice thing is we can make a new tray and get you in, but it's just a hassle. And so that's my number 1 tip. Definitely do not take your clear aligner out, put it in a little napkin thinking it's going to be safe, and put it on the table. Tip number 2. Typically we use the trays for 2 weeks at a time. And so we want you to pick a day that we call it tray change day. So let's say you start your treatment on a Monday. That Monday you're going to get your first tray. And then 2 weeks later on that same Monday, you're going to switch to the next tray. Now the next tray is going to be designed to put your teeth in the position by the end of the week. So there's going to be some pressure and some kind of force exerted on those teeth the first night. So my second tip is always change your trays at night. That way you've got overnight to kind of have your teeth get used to that movement, and in the morning it'll be less sore and painful than if you pop them in first thing in the morning and try and go through the day getting used to that first amount of pressure. Generally speaking, the amount of force and discomfort when you put that first tray in, it's not a lot of pain, it's just a subtle kind of pressure. And so at night, you're going to be able to sleep with it, and by the time you wake up, you're going to be a lot more accustomed to it, and it's not going to be as big a change or an impact as if you put them in first thing in the morning. Tip number 3. I would recommend at night, when you first put your new tray in, take some kind of pain reliever, whether it's Advil, Tylenol, Aleve. A lot of times that'll knock out that initial discomfort, and when you wake up in the morning, you're going to be good to go, ready to rock and roll. So if you've noticed that your teeth look a little bit different, or you don't like the way everything looks on your pictures or in the mirror, give us a call. Come in and see us. We'd love to sit down and talk with you, go through your options. And at the very least, we can kind of plan out a case and show you what all would be involved in realigning those teeth and moving them to the proper spot. So come see us. And as a bonus, Oakley would love to see you as well. Tip number 4, do not be tempted to eat or drink in these trays. I can say that with certainty because I've had patients come in that attempted to drink red wine, or younger patients that had grape juice or some other kind of staining liquid, and it creeps right in between the tray, and it only takes 1 or 2 sips that all of a sudden you can stain the trays. And even though you can clean them with a toothbrush and you can really get in there and try and get that stain off, if you do that, they're going to pick up the stain, and then for the next 23 and a half hours of every day, it's going to look like you've got kind of stained, grungy teeth. So I'm not saying you can't have wine, I'm not saying you can't have those things, but if you're going to do it, take the trays out. And a lot of times I've found that patients, the hassle of taking the trays out and trying to keep up with them, they're like, you know what, I don't want to deal with it. I'm just going to skip that snack. So as a bonus, I've had some patients lose weight with it. Tip number 5, don't think that just because your furry friend loves you, he's going to respect your clear aligners. Dogs, and actually cats as well, love the smell of their owner's mouth. And so you take that tray out, put it down, turn your back. This little guy or the one you have at home will absolutely love to chew on that thing. And all it takes is about 5 seconds and the tray is destroyed. So beware when you do take it out to clean or to eat, don't put it in a napkin and don't leave it anywhere where your little furry friend can get to it. So long story short, braces have come a long way. So it's no longer your only option is to have a metal mouthful, braces and brackets and wires. The clear aligner treatment option is definitely available for most patients. So if you're considering it, definitely come see us. One of the other advantages of the clear aligner treatment is we plan it out from the beginning, and so through our design, you don't have to come in for constant checks. I know, conventional braces, or back in the day, you'd have to come in every 2 weeks and have the orthodontist or the dentist go in there and tinker with it and make little tiny changes. But with the clear aligner therapy, we don't have to do that. So if you're an out-of-town guest, come in, see us. The Intercontinental is a beautiful hotel. We've got to deal with them. We can help kind of make your stay a little bit easier. Come see us. We'll work your case up. I can talk to you about what your options are. Then if your treatment is, let's say, 24 weeks, 36 weeks, I can give you a series of trays so you don't have to come back every 2 weeks. You can do the therapy at home. And so that eliminates the need for a lot of travel and a lot of check-in. So don't be afraid to come see us if you're out of town. Like I said, we've got accommodations that can help you out. So as we've grown on YouTube, we have a lot of people from out of town that have started following us and actually come in from out of town to see us and seek treatment, which is great. And so what we've done to help make that process easier is we've partnered with the Intercontinental Hotel, phenomenal hotel, great facility, and we've just made the whole process easier. So if you're out of town and you're wondering, is it worth it to come and see us, come see us. We'll get your dental treatment, we'll get a plan together, and you've got great accommodations right there. Call us at the number above or click on any of the links below, and Oakley and I are excited to see you. I'm Dr. Brett Langston, and this is Oakley, and we're here to help you watch your mouth.